Nearly 80,000 people are diagnosed with a brain or spine tumor each year, according to the National Institutes of Health. Both benign and malignant or cancerous brain or spine tumors can lead to serious damage or even be life-threatening, which is why it's crucial to have a personalized care plan with the latest techniques and treatments available. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about the newly expanded Neuro-Oncology Program at St. Luke's that's dedicated to treating these patients. With me today is Dr. Samuel Goldlust, a neuro-oncologist at St. Luke's Cancer Institute, and Dr. Jonathan Breshears, a neurosurgeon at St. Luke's Marion Block Neuroscience Institute. Thank you both for joining us.
Thank you for having us.
Well, first, Dr. Goldlust, there are more than 100 different types of brain or spine tumors, and each patient's case is unique. How does St. Luke's Neuro-Oncology Program tailor each treatment specifically to each patient?
Well, I think something that really sets us apart is we've assembled a team of subspecialists, be it neuroradiology, neuropathology, neurosurgery, neuro-oncology, all of whom are highly trained just to take care of patients with brain and spine cancers.
Mm-hmm.
We put our collective minds together to try to take the best possible care of the patient that we can. And on the patient-facing side, we've learned over time and through developments in science that although a patient may have a tumor with the same name as another patient, there's a genetic signature within that tumor that gives us some windows into why that particular patient's tumor grew and gives all of the subspecialists an opportunity to really focus in on what might be unique about that particular person and how to help them the best.
Okay, very interesting. And Dr. Breshears, the neurosurgery team plays a major role in this program. Can you tell us about some of the latest innovative techniques and treatments at St. Luke's that benefit these patients?
Sure, that's right, Lindsay. When a patient comes to the hospital with a symptomatic brain tumor, the neurosurgeon is often one of the first physicians they'll meet.
Mm-hmm.
And at that point, the goal is to, get a diagnosis for what type of tumor we're dealing with and often remove as much of it as safely possible. So depending on the location of the tumor, what type of pathology we suspect, that dictates our surgical strategy. And so at St. Luke's, we offer the full spectrum of available techniques, whether it be brain mapping, fluorescence-guided tumor resection, intraoperative imaging, to help us do that. So, for example, if a patient comes in with a tumor near the language areas of the brain, we'll get a special type of MRI that shows us the connections between the various areas of the brain called diffusion tensor imaging. And with that in hand, we can take them to the operating room, keep them awake, and during surgery, map out that network in order to preserve their speech function while removing the tumor. That patient would also likely receive a medication before surgery called 5-ALA or Gleolan, which causes the tumor cells to selectively light up under our microscope light, so we can identify them in order to maximize how much tumor we remove. Another example is a patient who maybe was previously treated for a brain tumor, and now that tumor's come back and they've had surgery before and they've had radiation before, and there aren't a whole lot of other options for them. That's a patient where we can go in, perform another surgery to resect the tumor, and then place special tiles that deliver very focused radiation to the area where the tumor was before. And that's something that is now an option for patients, whereas before they may not be a candidate for other types of treatments.
Right. Fascinating. Well, Dr. Goldlust, can you talk about some of the research you hope to advance with this program?
Sure. So a little bit of background is that brain tumors historically have been a challenge for a few different reasons. The brain is a particularly sensitive organ. So surgery, even if you have the most talented surgeon, surgery is limited in that if you are too aggressive, you could actually cause the patient harm. Radiation has the same limitations, and that radiation can only be given to a certain dose before the benefit again becomes harmful. And traditional chemotherapy drugs don't often reach the brain because of something called the blood-brain barrier in enough of a concentration to actually fight the tumor. So that presents some particular challenges that make brain tumors different than other types of cancers. But that being said, as we touched on, with our advances in genetic analysis of tumors, we can really hone in on what makes that person's particular tumor different from someone else's. And we can target those abnormalities with innovative and forward-thinking clinical trials, not only to fight the tumor, but to minimize side effects of treatments that might otherwise be sort of more wide-acting across the body.
Right. Great. Well, Dr. Breshears, St. Luke's also offers a skull base and pituitary tumor program. Can you tell us a little bit about what makes this program unique?
Sure. So just like tumors can show up in the brain, benign and malignant tumors can grow around the brain in an area called the skull base. And this is one of the most anatomically complex areas in the human body, where you've got the intersection of the base of the brain and the brainstem, the cranial nerves, the arteries and veins that supply blood to the brain, the pituitary gland, the visual pathways, the nasal cavity. And so this is an area where when tumors arise, it requires the expertise of multiple medical and surgical specialists to take the best care of a patient. And so our program is unique in that we bring together the specialists, both medical and surgical, from all those disciplines onto one team. So from front to back, we have a neuro-ophthalmologist taking care of the visual pathway, an endocrinologist for the pituitary gland, a rhinologist, skull-base surgeon for the nasal cavity, neuro-otologist to take care of hearing and the facial nerve, as well as a neurosurgeon, and then plastic surgery to help reconstruct and close complex defects if surgery is needed. And so with that team together, tied together by our nurse navigator, a patient with a skull-base tumor can be referred and have all of their visits set up, all of their testing set up. And we try to do it as conveniently as possible, oftentimes just in one day. A patient can travel from hours away, be seen by multiple specialists, have all their testing done, and go home with a plan.
Gosh, that's great. Well, Dr. Goldlust, what's your takeaway message for those who are watching?
Well, I think we as physicians and the rest of our team know that a brain cancer diagnosis is a very scary situation, and nothing that anyone is prepared for at the time that it comes along. But our goal is to meet as a team with the patient and their family as early in the process as we can, and to go over how we're going to help them step by step and week by week, month by month, and really give them a very cogent outline of what to expect, what we're doing and why, and how we're going to maintain their quality of life the best that we can over a process. And oftentimes we feel like if we can give people that little bit of peace of mind, it makes the whole stressful situation just a little bit easier.
Okay. And what would you like to add to that?
Yeah, I think that's exactly right. I think we're bringing together experts who deal with precisely this problem day in and day out. So while for a patient, this is a once in a lifetime, overwhelming thing, we hope to make it convenient and understandable and digestible and comfortable for the patient to come and be seen by everyone and have a good plan that they feel comfortable with.
Absolutely. Well, thank you both so much for joining us.
Thank you for having us.
Thanks.
To learn more about St. Luke's Neuro-Oncology Program, visit stlukeskc.org/neuro-oncology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.